This is Jake the trach, and this is just a quick demonstration of everything that you need to have at the bedside. Okay, the first thing that you need to do is obviously go up to your patient, make sure that your oxygen is on. If he is on any, make sure that you have an ambu bag with a mask at the bedside, suction that is already there, as well as a Yankauer, and you also need to have a 10 cc syringe. If you have a cuffed tracheostomy tube, you need the same size inner cannula, okay, because obviously a different size will not fit in his trach. You also need a trach care kit. You need a cuff manometer. You need saline if your hospital policy calls for that, if they allow you to suction with it. You need hydrogen peroxide. I'm sorry, I'm not good at this. You need sterile water. You also need the size trach that he has, and a smaller size trach. Okay, so he has, always look at the side. On that side he has a 6 tracheostomy tube, and it is cuffed. Here's your cuffed, always find that. And you need to make sure you have a 6 at the bedside as well as a 4 at the bedside. Okay, make sure you check all of your equipment. In addition to that, you need your one last thing is your obturator at the bedside, just in case it were to come out. Okay, here is now Dr. Mazzoli. He is going to demonstrate sterile suctioning.
Okay, so you want to make sure that the pressure is correct, and you want to make sure that you have your large bore suction tube available, and a Yankauer if there are any upper airway secretions that need to be cleared. This is a little bit high, so I'm going to turn it down. Okay. Reattach this. Of course, we will auscultate for the need for suctioning before we do it. The assumption in this demonstration is that there is a need. Okay, now we're going to prepare our equipment, and we're going to do it in a sterile fashion. You want to open this up. If you want to leave it on, that's fine, but you're going to be fighting with it the whole time. I suggest that you don't. Then you grab the glove package without touching the insides of the bowl, and you want to open it up forcefully so it doesn't flip back open on you. Bend down the same way on this side. So you open that up, fold it back, open this up, so you fold it back, and then you're going to grab these two flaps. Now keep in mind that once you open this, there's no way that you are not going to have the edges of this dirty, because it's going to be dirty. That's the way that it's going to be, because your hands are stopped. Now fold this over in half again. Why? That keeps these edges from flopping back. You're going to want to take one glove. This one is stuck, and sometimes they do that. Alright, now it hit the edge, but it didn't hit the table, and I haven't handled that in the middle, so I'm still okay. Alright, I'm going to find the thumb side. I'm going to keep my hand on the inside of the glove, and pointing the gloves downward so the fingers don't touch my hand, I'll pull the glove up over this hand. This is my clean hand. Now I'll take this glove, find the thumb side, and I am going to stick my hand underneath this cuff, like so. Now, when I have it underneath the cuff, I've got complete control of this glove. I stick my hand in, and oops, I'm on the wrong side. Well, does that matter? No, because I have control of this cuff. I can slide it around, and I pull it on my hand. Okay? You need to use the gloves like you own them. Then I'm going to take this catheter out, not touching it on anything. I'm going to wrap it around my hand, and hopefully the tip of the catheter will be pointed in the opposite direction that I'm going to use to connect this to the suction tubing. Now I've got complete control of it. I can take my dirty hand now, and I can attach this firmly. Now once this is attached and I've unrolled this, I'm ready to go. And would you help me with the FiO2, please, Hannah?
Yeah.
We're going to pre-oxygenate the patient for a couple of minutes. And we're going to turn the flow up to the appropriate level for that entrainment. Now, for the sake of brevity, we're going to assume that 2 minutes have passed. At the end of 2 minutes, we're ready to suction. Now, as long as I have this hand on the catheter, it maintains clean and sterile technique. Now, I'm only going to let this touch the inside of the airway, not the chin, not the bandage, not anything else. And I'm going to go down until I meet resistance, which is typically the carina. I feel a cough. The patient coughs. Now, if I apply suction and all I get is secretions, then I will keep the suction on continuous. And I rotate it back and forth. Why? To clean the airway out. If I'm not getting any secretions, I'll use intermittent suction technique. And as I pull this out, and I'm done. Now that took a little over 15 seconds. Why? Because I'm explaining each step. Now I go back and I can hyperoxygenate the patient again. Stethoscope on, listen to see if I have indication for suctioning again. If I don't have indication, I'm finished. If I do have indication, I repeat the procedure. Now, again, I can take care of this by wrapping it up and pulling it off with this gloved hand, and pull the glove over the dirty material and put it in a biohazard disposable container. Once that is completed, I go ahead and reestablish the oxygen therapy. I auscultate the patient, make sure that their vital signs are okay. If the vital signs are normal, then I'm good to go. If they're not, I remain with the patient until the vital signs become stabilized. It's at this point in time, I can return them back to their oxygen therapy. Clean up the bed. Have the oral suction ready. The yank hour. This is not a Yonker. Yonkers is a place in New York City. And we'll attach it over the flow meter like so. And that's all there is to it.
Thank you, Dr. Mazzoli.
Thank you, Miss Hannah.